all here with cancer stories today, and I think it's lovely looking around at the smiley faces that although we're going to talk about various things, everybody's still here and still smiling. I think the first thing I'd actually like to ask, if you didn't mind me going around, is how you were diagnosed in the first place. What symptom did you have that made you go to your GP, presumably? We start off with Janet. What happened with you?
It was my second screening appointment for a mammogram, and they found a lump, or they found a cancer. It wasn't a lump, it was a lobular cancer, very deep-seated, and ironically it was in this breast, the left breast. And I thought, when I went for the mammogram, I thought it would be in the right breast because this hurt when they did it. I thought, oh, that hurt. So they found this, and I was away in Ireland. I was doing some work in Ireland, and the letter came for me to go back for recall. My husband opened it, and he said, he rang them up and said, will it wait a week? They said, yes, but she must come. And then I went on the Tuesday, I think. No, I went on the Thursday. Totally, I just thought it was a wrong camera shot, or I just didn't expect it. And that was the Thursday, and by the Tuesday I was in the operating theatre.
Oh, that's quick. Yeah. So you had a very speedy... Was yours also a speedy diagnosis? Or did you find...
I found a lump.
Were you in the shower, or what?
Just because I'd checked my breasts anyway.
So you were checking them regularly,
yes,
which is something I'm sure now people recommend, because I didn't use them.
And I thought I found a lump, but then I'd check again and think, no, I haven't really. So it was 2 months before I thought I should do something about this. But then I made an appointment at the doctor's, and first time, although I told them what it was for, there was just a male doctor, and he said, well, I can't do anything because I need a nurse here. Make another appointment. So I made another appointment, and the same happened again. And the third time I went, and I was having a routine smear test at the same time, and I'd asked for an appointment alongside it to check a lump. And she did the smear and that, and I said, all right, you need to check this lump. And she's like, have you seen my waiting room? I'm, absolutely rammed. And I'm like, I don't really give a stuff. This is my third appointment.
Yeah.
This is
that is.
And she checks it, and she was like, right, yeah, okay. Shock horror, because then 2 weeks later I was having surgery.
So as soon as they found it, it was a very quick thing.
Yeah.
And what happened with you, Sue?
I've had something catching on the underwiring of my bra, and I looked at it in the bathroom mirror for months.
So you'd been ignoring it a little bit, like?
A little bit longer, probably.
Oh.
And then eventually I went to the doctor and just said, oh, by the way, I've got this. And he squeezed it and just said, oh my God. And actually the nurse was in mine, and she looked horrified, whether it was his quality of his bedside manner or whether it was just, that she thought, oh dear, she's obviously got cancer, I don't know. But after I'd been to the doctor, obviously I was referred to the breast care clinic. But in the meantime, after that, my nipple started to invert, and my breast started to crawl around under my left armpit. So it was trying to hide.
Oh, it wanted to go away.
It wanted to go away,
wanted to leave
So
you.
I was saying to my friends, I just think I've got cancer. And they're going, no, you're not. We've looked up. It could be a cyst. It could be. I said, no, it's doing all of this. I don't think it is.
So you felt you had an inkling about that, yeah?
I kind of knew. I think. I certainly did when my doctor reacted in the way he did.
Yeah.
He was very shocked.
Horrible.
And what happened with you, Dawn? How did you find your...
Well, that's a bit strange, one is.
That's all right, we don't mind strange.
Well, I wasn't very well to begin with. I got to the doctor and was virtually passing out. She just did the routine here, temperature and blood pressure and all that. She said, there's nothing wrong with
You got flu.
Yeah, so... But then I went out with some friends. We went pole dancing. We just went on the night.
That sounds good. A regular night out.
Pole dancing. I love it. Let's give it a go. It's really good exercise. So
It is. Very good exercise. That's right,
way
yeah.
to get fit. I could have done with a bit more then. But actually, while I was doing something on the pole, I don't know, I just landed funny, and it really took my sails. It took my breath. I felt really dizzy. And I just thought, I've just got to go and sit down. And for the majority of it, I did sit down. But then there was a lady there as well that had got lung cancer. And I thought, well, she can do it, I can do it. She just inspired me to go in, really. So I did try and carry on a little bit more, but I couldn't do it. I just found it really hard. And I don't know what it was. It just felt really weird. So I went home and had a rest. When I went to bed and I actually laid on my side, and I went, cow, that hurt. And calls and I felt my breast, and I said, and I said to John, my husband, I says, he wasn't then, he was my partner, my husband now. I says, can you feel this? So he says, yes, and you're going doctor tomorrow. I went, we'll see, and went to sleep. However, it did niggle at me. It does niggle because at the time I was on a project volunteering for Be Clear on Cancer.
Oh, dear. Yeah.
And it was about the early signs and symptoms of breast, bowel and lung at the time. Wow. And I was going out preaching to all these people who need to go to the doctors.
Goodness.
And then not doing
and I
it.
stood there thinking, I've got my head in the sand here, this is not good. So then I obviously went to the doctor.
It's very easy to do that.
It was. I was being an ostrich, my head in the sand, thinking, it'll go away, there's nothing there. But obviously you kept feeling it as you do. But then I went to the doctor and I saw this clinician. Well, that was a waste of time. Absolutely. I can't stand her. I don't know how she's still a doctor, I don't know. She felt the one with the lump first and then went to her, nothing wrong with you, are you due on? Yes. So she'll come back in a couple of weeks.
Oh, brilliant.
I couldn't wait a couple of
Brilliant.
weeks. So I took a friend with me for a bit more moral support, as you do.
Good idea.
I saw a different one and within 2 weeks I was in the breast screening.
Yeah.
However, that was chemo first, but they didn't tell me why I was having chemo
Oh, right,
first.
that's bad news, isn't it?
They didn't tell me that because everyone said, why are you having chemo first and not a knot? And I'm like, I don't
Yeah,
know.
same here really. Well, after I had the lumpectomy to start with, that's what I had the first time, and then they said it wasn't cancer, and then they said it was, so it was, and then I had the chemo, and I thought, oh, that's it, I won't have to lose my breast.
Well, I was hoping that the chemo would shrink it.
Yes, I mean,
Yes, yes.
yeah, no.
Might be right. 'Cause with mine, they said it was where it was positioned and the size of it.
Yeah.
They needed to shrink it.
It's such a
Well,
variable
it was
thing,
actually
isn't
7.5
it?
centimetres, and actually size
Wow.
of the leg.
Wow.
And they've only had it 6 months apparently, so I haven't done anything about it.
That's
And you hadn't felt it before
No,
this time?
no, I just felt a bit unwell. Every now and again.
too busy. Too
It
busy
was
preaching,
well, it was, actually.
preaching what you should do.
Well, I was
should do
busy
it, yeah.
volunteering. I got a daughter at home, looking after the husband. I was running around doing other volunteering.
Didn't have time to
things.
think
Didn't
about
have
yourself.
time for me.
I think that's a lot of it, really. You don't. I mean, I was never ill, and it was such a shock when I was.
I think
so-
it's the shock
I was
angle,
just-
isn't it?
I was just thinking, I can't be right. And then I remember laying in the breast unit at Glenfield, looking up at the ceiling, counting the tiles, thinking, well, what's all the fuss about? And then they're calling more and more people in to see this spider thing, this lobular cancer, and I'm thinking, well, I can't really. And I just lay there, like I was just thinking, well, can't really believe it, really.
See, when I went to the breast screening, I had an ultrasound first. Then I went for a mammogram.
Yeah.
And then you saw the consultant and he actually found you. And then he says, we need to send you for another ultrasound. And they said that the mammogram was actually all right.
Yes, you see, they could only.
Doesn't always pick it
It
up.
doesn't. You see,
I
that's the
know.
thing.
That was fine.
They saw it only on one view with mine. It couldn't be seen on another view. So
But then they sent me for another ultrasound and it was actually under the arm.
yeah.
And they took the biopsies from there, suspecting it was in the lymph node.
Well, I demanded because I couldn't believe it. I demanded after I don't know when it was actually, but I said, well, surely in this day and age, I'm not having my breast just knocked off. I want to know where it is and whatever it is. So they sent me for a CT scan where the boobs went in the
Oh yeah,
holes
yes, I did do that actually.
with a wire. So I said, I can't believe this is.
That's a horrible thing.
Oh, it was. God did it wrong. Anyway,
Cried through.
did it twice. Had to have it, do it twice. All the rest of
It
it.
makes such a horrible noise.
It did.
Oh,
so
that. And they don't give you
me roaring my eyes out thinking, I mean, and my friend was outside thinking it was only going to be 10 minutes.
I know you were
nearly
never
an hour, and they're saying, "Can you hear me?" Going, "Ugh." And the banging in there. I got to the point when my son's a musician. I got to the point thinking, I'm sure James could make some sort of music from this. It was bang, 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 and they don't give you any. They stand there and ear defenders. Why don't they give you them?
So actually it's lack of information then.
It is.
They didn't say, by the way, this is what's going to happen. This is what it's going to
In
sound
fairness,
like.
they did say it makes noise,
Well,
but
they
until
did,
you
yeah.
actually
They
go
told
in and
me to.
experience
It's like
it,
being in-
you don't quite know what they mean
It's
by
like
noise.
banging in a drum in your
Wow.
ear.
It's
That-
horrible. It was like something trying to bang together.
It's like this. It's like you're
And
in
then
the
you get
middle
an
of some.
infection halfway through as well.
Yes,
don't you?
that's
Yeah, I didn't know
delightful.
about that.
Is that radioactive?
Oh yes, that's
Yeah.
warm and
It
it's running
is.
through your body.
You
And
feel like
And
you're
you're falling on the toilet. Yes.
you feel like you're wetting yourself.
which is a bit disconcerting.
And then I got the
Oh,
wire.
say at the end, I'm sorry.
The wire was a bit trapped, and I'm like, Quasimodo in there. And I'm thinking, this can't be right. How can I get out?
You're not allowed to move. And
No.
Like you say, they're in round mould, aren't they?
Yes,
It's not very
you
comfortable
slot
at all.
yourself in.
I just find it amusing
It is.
how you lot put up with stuff
I know.
that you didn't
Well,
like.
we didn't at the time. until you
Well, I
asked.
did put.
questions.
Oh, I
because
did ask questions, but did.
All I did was ask.
Because we
exactly
didn't
what's
know what
gonna
to
happen.
expect.
But I didn't either. And I was like,
Do you not
"Well,
think though it's
through
your makeup or it's the
this."
situation that will?
It'll
put you in
depend
that
on your
place.
personality, though.
Yeah.
Some people are a bit like, so
I
I'm
like
more,
to keep my head in the sand.
I'm a bit more like that. If something's going to happen to me and it's a fait accompli, I don't really need to know the dots and the eyes.
No, they did. I.
Well, other people
I
like
do.
yourself do,
That's
and I
the
think
right
you like to
code.
know a bit of what's going
I think
on.
Because
don't
it
you?
went
Yeah.
too long.
Yeah.
Because I
As soon as I got diagnosed, like that's when it started. And obviously, when you come out of consultants, you've got hundreds of questions in your head, and you don't see them again. I think, well, I'm going to get all these answers.
well, I put my foot down a little bit because my background is in medical,
Yes.
and I remember you asked us all at the beginning about how we found out about the cancer. Well, it was a joke with us at work. To be fair, I got summoned for a mammogram,
Yeah.
a national one, the first mammogram I'd ever had in my whole life. And we joked because I said, "Oh, happy birthday, happy 50th."
Yeah, exactly.
And we laughed as I went to the appointment. And I was optimistic, it's good for screening. I'd always gone for screening, I'd always
Yeah.
self-examined.
Yeah.
I had an awareness of stuff,
Yeah, I think I did,
I went feeling very optimistic. I had it. To be fair, if you talk about how you feel coming up to it, I had felt generally under the weather. And the breast that I had the problem in actually was painful. And that's another interesting thing. That's down on the list of one of the things to look for if you've got pain.
Well, that's
And
what
I
thought.
had mentioned this a few times at various visits to my GP and said, "Oh no, it's hormonal. Okay, nothing to feel, nothing to..." And I suppose really one of the things I've learned of having breast cancer is it doesn't manifest itself the same in everyone. It's not going to be
Everybody's
something where you go
No.
and you feel a lump or you
No.
see an obvious change like you did. So.
No.
Yeah, but the obvious changes
Yeah.
weren't until after I've been to
Yeah,
the doctor. And I think
exactly.
actually, because I had a tumour, they're very good at hiding.
Yeah.
They do hide away tumours,
Because I'd always thought you checked what's wrong with the flat of your hand
Yeah.
and rub,
Yeah.
but don't do that. You grab them really. Give
Have
them
a good
I've said this
feel.
before, but grab them a good squeeze because tumours do like to tuck themselves away.
Yeah, mine was only felt in a certain position.
Yeah. Well, the thing is, you were talking about with mammograms that you have and things like that.
Yeah.
My experience was I went, as I say, I had the mammogram.
Yeah.
I had it at a unit that wasn't at the main
Right. In a-
hospital.
in a caravan.
I had it in the mobile
Yeah,
unit.
mobile
Ones that
unit.
go
The
around.
screening unit.
Very good idea, mind
So, of
you.
course, when I got the recall then to go back,
Yeah.
don't know, open the letter.
Did it call
I
you back
suddenly
to-
thought,
It's the main one.
and I remember at the time I was married, my husband saying, "Oh, it'll probably be the machine." And of course, I
Yes.
fastened on to that.
Yes,
They've
yes,
not got
yes.
a good enough image.
That's exactly
You're
what
going
I
back.
thought, you see.
So
Exactly.
I went back and I immediately began to be a bit suspicious because it was early in the morning. I was first one on. I got a double mammogram. I looked over the sheet as I got to reception. I was a little bit naughty.
As you do.
And I could see.
As you do.
Yeah. She knew what she was looking
And
for.
I knew what to look for. And I thought, well, not that it's that obvious, but I looked and I thought, Then I found out that, little knowledge is a dangerous thing.
Indeed.
And actually, you will get a double mammogram when you go back for recall often because they want to compare one breast
That's
with another.
right,
yeah.
What's the normal one? What's the one look like with a problem? Then, of course, when you've got a young breast, the other thing they don't tell you is I had ultrasound because they couldn't see it properly.
yeah.
While you're waiting, the big fear factor, we've all been there, is climbing, thinking,
It is.
And everybody's there, all those women together in that open arena, some getting bad news, some getting good news. You're trying to tough it up. I was a big one for professionalising it because, oh dear, that doesn't happen to me because I'm that side of the counter. I'm not the patient. And I have an awareness. This can't possibly be happening to me. So I was all very... Until you get the actual it's cancer.
You see, I was exactly the same. I lay there, as I say, looking. They were looking at this thing on the screen, and she said, "Can you see this?" And I said, "Yes." I'm thinking, and then I said, "Well, how are you dealing with the PACS system?" I said, "Well, how's it going down?" So she said, "Oh," I said, "I don't think it's very good." I was talking about information systems to her and everything, and I said, "It's not very good." She said, "Look," she said, "you can sort this out when you're better." And I thought, what does she mean when I'm better? And at that point, I suddenly thought, oh, that's
There's
the
something
breast.
going off here.
She said, "Can you see this here?" I said, "Well, not really, no." I said, "It looks a bit like..." I said, not really, desperately. And she said, "Well, this part here." And I'm thinking, oh, yes. And I don't think even then it dawned upon me that it was going to be quite
a realisation.
I didn't realise how serious it was going to be. I really didn't.
No.
I really didn't. I lay there and I thought, okay. But I didn't.
You feel a bit... I think you feel so vulnerable, don't you? Because all I remember going is, you know, when you have your mammogram, you had that and it was quite painful.
It's very painful.
Got to be done.
Yeah.
Very
And,
painful.
You know, we're
but
here
you fall into
to have the job done.
falling into it.
Then when you've got younger breasts, they need to have a better look. You can have
Mammograms aren't that painful,
No.
ladies. For those ladies that haven't yet had them, they're uncomfortable.
Yeah.
They're
not-
uncomfortable.
Wrong, aren't
Yes.
they?
They're a
They're still
necessary
awkward.
part.
They're awkward. But
they're not
usually the
No, I think uncomfortable.
uncomfortable is the word.
But look what they can find.
They
Exactly.
can.
So don't be scared of them.
Yes,
I
you've
would
got to
say go and
have
have
one.
it. Because if I hadn't gone,
Yes,
Yes.
I'm there.
I would not be sitting
No.
here.
And this
I'm
is the same
sure.
with you, Julie.
It is
Yeah.
a very... Because mine
So
was,
we're promoting it.
not
despite-
a lump to find, unlike
No,
you
no,
ladies.
no, mine
No
wasn't.
lump, no change physically.
No.
And it was deep, the area.
Yeah.
And I actually sat there and I said, I was blaming myself, oh, did I do something wrong? Because there was no... I couldn't feel anything. So that's
Were you
because
ill before?
no,
Neither
only
was
with
I.
the pain and feeling a bit unwell. But what I'm saying is, what I'm coming to is, sometimes it doesn't manifest itself as a lump, which is why mammography and the ultrasounds that you have after, because in young breasts you can't always visualise things properly.
No.
In younger ladies or denser tissue, medically apparently, which is why you have that next stage. That's saved my life. If I hadn't have gone for screening and I hadn't have had recall,
Me, yeah.
you can't.
So
put
what
a
we're
price on it.
saying
I
is,
know you get.
despite the outcome, screening is
Well,
really
and
important thing.
despite there are some statistics saying, oh, screening is not very good and all the rest of it, and it's
better than not.
better than not.
False positives and false
I would-
negatives. It needs
I
to
would
needs to be done.
advocate it every time.
So would I.
If I hadn't gone for my second one, you
Yeah.
went on your first, I was on my second. You know, I would not. It's unbelievable, really.
Another thing I'd say about mammograms, I remember being in hospital and the woman in the bed next to me, we were talking, and she'd had a mammogram less than a year before,
Yeah.
and she'd got breast cancer, and her mammogram had been clear. And obviously she had then thought, oh, I've got a clear mammogram, that's all right, then I've got, I'll be
Yeah.
fine.
No self-examination after that.
self-examination
No, you
afterwards.
can't.
It doesn't
You need
give you
both.
it's not a clean bill of health.
It's
No.
a guide.
It's a check at that point in time.
Yeah,
So-
yeah. Well, it's like a smear, really, isn't it? But that's
Yeah.
I mean, Susie
Yeah.
was on about information. Well, I did actually say, will it not squeeze my tumour and burst it? And she said, no, but it can actually do that.
oh,
So,
Lord.
initially, I was getting
Yeah.
there. It was just
What
little
you-
bits. Yeah.
Yeah.
I was
It
absolutely
is digging your
petrified.
heels in because it's like saying with the scans and that, and you saying that halfway through they're going to inject into you. Well, because I'd had my chemo and everything, and I'd got freaky about needles.
Yeah.
I'd just gone stupid.
That I can
about
understand,
needles.
yeah.
My veins were collapsing into the
Yeah,
vagina
so
100
annoying.
times to get needles in. So when she said, "Oh, of course, we'll inject you halfway through," and I said, "No, I can't do that. You're going to have to do it now. I can't lay there thinking about halfway through.
I'll have a
You're gonna
needle in
put
my
a
arm,
needle in."
yeah.
I said, "You're going to have to put it in now, so I know it's done.
Done
All
in
you have to
place.
do is connect to it as and when." And that's what we did. But she did get funny with me, and I did say to her,
So you've got to
"It's not
stand
you
up for
laid
yourself.
here.
Yeah.
No, if you can deal with that, fine. It's me laid here and I can't. I'm telling you the best way to do this for me and for her. Because I would.
Was that in CT then? That
No, then CT.
And I
Yeah.
have just got silly with me.
yeah, I do.
Still am now.
I went for a checkup back to CT, and my veins had shot it, and that became a real thing for me. That I got to the point where during chemo I had a problem, and
So
you
did
know,
I.
negative, couldn't get in the building, feeling sick, panic, rushing to the toilet, all these very obvious things about people not, you know, you going into meltdown, and I couldn't understand it because I'd dealt with things, and then all of a sudden I couldn't deal with that. But I went for CT, and they are not the best people to get needles in there always, I don't think, but they have to do it. In the end, they came down from, well, I had to go up to chemo. To
Came
be
down from the ward,
cannulated
yeah.
every time, and then come down. And because I empowered myself then, I just said no more attempts to do this.
I think it's important to do that. I remember going for chemo once and they put it in and it hurt and my arm hurt and I was like, it's really painful.
Yeah.
And they said, oh no, look, it's going in, and they did all of that.
I said, no, it's
I got a blood clot.
Really?
So I could feel it through the whole of the chemo. I thought this really hurts, but it's not normally like this. So I think it's important. Trust your own body, even at points
Yes,
like
listen
that.
to what your body's
Yeah.
saying is
I should have
important.
said,
I think
no,
we
it's
do
not
tend
right.
to put ourselves, especially when we're feeling vulnerable, in those medical hands and think they, you know, they're completely in charge. Well, yes, they have directives and there's things that have to be done, but at the end of the day, it's still your body. You're still going through a process that you really will feel a lot better about it, like Sue says, if you own some of that. I mean, I remember the doctor saying to me way back at the mammogram that got called in, and I was freezing cold having the ultrasound after the mammogram, and then I'd got to have one of these punch biopsies of the breast.
Oh, they are
which
horrible.
are extremely
The
uncomfortable.
grabby things.
Oh,
But again, a very necessary evil to find
absolutely,
out what's
yeah.
oh, they're
happening.
vile. They're vile.
So you think, yeah, well, okay, we're in this position, you know, we've got to deal with it. And I was dealing with it, and the doctor came in, and I just asked a question and said, well, she told me I'd got cancer. And I said, well, what will happen now? Meaning, what is the next stage of the process?
Not in
I've
the
had
next
this,
minute.
I've had a punch biopsy, do I come back? Am I going straight off now into Glenfield? You don't know, because you've never experienced that. Are you going to be on the theatre table within a week, 2 weeks, whatever?
Tell me the
That's all I was asking.
tell
Was,
me the
what's the next
prognosis.
process? Is there more testing? And she took that completely the wrong way and went, well, I think you know what will happen. It's got to be removed. We don't keep it in there. And I was like,
Silly woman.
and I thought, I'm not asking you about do they leave cancer in there. We all know that it's got to be removed. But she just completely, and I was really quite
Well, it's like
upset
them saying
about
to me,
that.
well, if she doesn't have surgery, she'll die.
Yeah.
That's actually hadn't been the question we were asking, hadn't been the point that we were making, but then she said that, and we were like, both my friend and I burst into tears, and we were
Yeah, I'm
crying
not
for ages.
surprised.
And it still affects my friend now. She said, she still mentions it.
It's not good. It's not
And I
good.
think, well, hang on.
I think sometimes it must be difficult for them as clinicians to give you that information. To try and gauge in that few minutes of having that person with you as to they don't know what's going on in your life already. They don't know how you're going to take it. They don't know what personality they are. But I do think there ought to be a lot more training around that, especially in
they
these
don't know how to
specific
talk
clinics,
to
aren't they,
people.
that they're dealing with it
I
in.
think because they're dealing with it so much.
Yeah, it
They
becomes a factual
They
thing.
put a shell on.
Yes.
The
and they
emotional
don't
side.
appreciate
Yeah.
how raw it is for you.
No, I don't
how
think they
lost
do.
You are.
And
All
how.
you want to know is which is the turn I take on this road now.
Do you think there should therefore be an immediate return appointment? When you're told, do you think you should just be told that's it?
No.
Come back
No.
tomorrow? Or do you think you want to know it all?
Loads of questions, like a second walk out.
So how is it best handled in your
Probably only a
opinion?
week, like you say.
No, we,
Come back
Or
and
even a
ask?
phone call.
a week's a long time. I
Do you
mean,
think though
got
that's
to be
logistics? Because you
more-
just imagine how many people
Yeah.
they'd have to. That's what I'm
Well, even
thinking.
some-
Because you haven't got time to sit
How
there and
many
ask the
people they'd have to have
questions.
clinical staff there for? And don't get me wrong, I think it should happen, but
The
what I'm
clinics are
saying
busy
is
enough anyway.
a
aren't they?
financial,
They're so busy.
logistical
But I
thing to
think
bring
it-
those patients back.
It's probably
See
a
them
case
in-
of accepting how important you are.
Yeah,
As a
you're
person.
And standing up for your rights. You
Yeah.
don't
Yeah, but if you
have
don't
to
know
just
anything,
go
how
with
are you
what
supposed
they're
to do
saying.
that? I mean, I didn't know anything about
But-
chemo. She didn't tell me what was going to happen, how it was
No.
going to happen. But yeah, she probably told everybody the same day, the same thing, but she missed me out, and I was petrified.
So was
And I
I.
think
For the
that's what
fecking
they've got
treatment.
to be trained to sort of judge.
Do you think there should be a separate area for people to then go to digest it and have a couple of nurses in there?
I
to
got
answer
taken off to a
questions?
room because I was in
I don't
meltdown when I
know.
first
and then you
got
can go
told.
if you want not.
And
I
have
had
a
my
cup of
first-
tea with a nurse.
So was
Those
I.
breast support nurses.
Yeah,
And
I
they
was
were
upset.
pretty good.
They're
I have
good.
to
I think
say.
they should be a bit more forefront because you don't always.
Yeah.
I didn't
See,
get mine to me
yeah.
off, because some people get it right from the
Them.
beginning.
Do you know why I
You
think
did
that
get
is
off.
though? I don't think there are enough of them because
I
I don't think there are enough of them because
I don't think I
There
ever had
aren't
one.
say
enough,
from
no.
my
You need
experience,
more.
going back to that waiting area, and let's face it, screening, the brilliant screening that you get, as well as the self-examination and the information that you said is out there with the job that you did, thank goodness, fills the room full of a high volume of ladies being recalled to discuss results and things like that. But if you think about it, I think I was probably sat in an open area with about 30 women.
Yeah.
I don't know what the percentage of us that was going to be happening that we were sat down and
No,
given what I
no.
call the 11 o'clock appointment now, which is when I got told I got cancer and I looked at the clock and it was 11 o'clock. So that's what I nicknamed it. That was, oh, you don't want the 11 o'clock appointment now, do you? So, but what I'm saying, and not wishing to minimise that for anybody, but I had to make a laugh out of it because, you know, that in time, you move away from it and
You've
you
got to
learn
be
to get
able to.
the funny stuff out of the really
You do, but it's
crappy stuff. But
it's
how many nurses would you have needed to deal with those women getting those
Oh, loads.
11 o'clock appointment news on that day? I bet alone there would be anywhere between, I was only in a morning session and there were 3 or 4 of us.
the
going on.
sessions
So
are rammed.
just
I
think
mean,
there must have been
absolutely.
probably a potential of 8 to
Very
10. How many nurses would you need to keep pulling you out, taking
Well,
you off?
doesn't this
while
bring
they-
in the idea of volunteers again?
Yeah.
I mean,
Yes.
would
And
it
people
not
that have been
be
through it like
What
a
is
good
that?
idea to have
Yeah.
volunteers who have had breast cancer
Yeah.
working in a
And
breast
every other
cancer
cancer.
and all the
So
other
you
types
have
in the
then got
clinics?
People who are perhaps a bit more forceful, like me.
Yeah.
Say to somebody like,
Yeah, as a support.
this is your body.
Yeah.
You
Yeah.
decide what you
I think
want,
it could
you
be a
tell them
huge
what
thing
you
for the
I
want.
think I
mental
would
health.
give you the power that you to be able to
Yeah.
get through what you need
Yeah.
to.
Yeah.
I would
But
just
if they
say
ask
that-
it is there, but you have to
But
ask
unless
for
you
it.
ask,
have
they
to
will
ask.
not.
Oh, no,
They
no,
don't
no.
offer it. No.
No.
It's
My-
only because I will ring up and say, I need to come in and see you.
Oh, that, yeah,
And I
that's...
said, and they say, oh, well, we don't normally do that. Well, no, but this is important. I'll be in. You see, this is me. I'll be in at 2 o'clock.
Yeah.
And they're like, oh, yeah, okay. I just take
good
the
for you.
control of
If
it.
somebody said to you, look,
But it's being
if you
very
go to that
I
room
didn't know
there,
you
there's
could
a
do that
couple of
either.
girls who've
That's
gone
what
through
I
it and they'll talk to you. I think a lot of people, not
Yes.
everyone, would dive in there and say, have you had it? What happened to you? I think it could be a huge thing that they could do automatically.
Yeah.
Have an area where somebody
I
who's
think
gone
it's.
through
I think
it.
it's quite a difficult thing to
It's not for everyone,
implement
obviously.
because
Yeah.
then
we've got
Yeah, just
huge.
for people that want to do it, that's fine.
No, but we've got huge amounts of ethical problems and
Who talks to who?
who
and
talks to who,
privacy
the information
and
giving. I mean,
information governance. Yeah.
the governance aspect of it is
I understand.
absolutely crucial.
I
And
know.
and
So it would
we're
be
in
difficult,
in an era of defensive medicine, so you get a gung ho volunteer saying, "Oh, it was like this for me, and I was this, and you
What
want to
about
turn
a chatty
the."
morning with
Yes.
coffee? That's all we're on about.
And I think it's a good idea, but I think it needs thinking about very carefully because
I do understand what
some
you're saying.
people are very sensitive, and
Other people say
some
a
of
lot,
the people
yeah.
just are not. And
Yeah.
Some people are taboo and don't even want to talk about it.
I just think the whole thing is just fraught with anxiety. And but if somebody could be an advocate and hold your hand and say, "Yes, I'll deal with this for you.
So did
You don't need to ring the
I do it
hospital."
anyway. I do it over Facebook.
Be like having a mentor.
Yeah, I do.
Yeah.
Yeah.
So if you feel you need somebody to
Somebody ring
help
up for
be a
you
bit
and
more
help
vocal.
you. And,
Yes.
Yeah.
They
But
are
I should be
just
out there to be able
mentor.
to find it, whereas at the minute
And
it's
easily.
not.
Yes,
Yeah.
easily.
Obviously.
Would you like somebody
Because-
to come with you? Would you like somebody to
Yeah.
ring up
Yes.
for you? Would you like
Yeah.
somebody to
Yes.
talk to you? I mean,
why are you doing this? And
before I had my reconstruction, I was very unsure. So I did ring the clinic and I said, I don't know what this looks like. So they did get one of the ladies who'd had a tram flap to come in and spend time with me, about half an hour, and she stripped off and she showed me what it was like, and she said, well, I'm very proud of mine.
Oh, that's really good.
But that's
isn't it?
not normal service.
No.
That's not...
No.
You
I
had to
a
ask
book
for that, didn't
for
you?
that.
Did you?
I had a book.
well, I was...
it Pink Hats it was called?
Goodness knows.
And it was about a lady, and it went in word for word, in description of what she went through with tram flat. And I went with 4 reams of pages by them from my consultant,
Right.
saying, I'm absolutely ready for this, get on with it. And he was really empowered by having it, but that was the knowledge as I went along.
Yeah, but you didn't
I
see...
obviously got hungry and I was a sponge and wants to know everything.
You
then.
didn't see one.
It was in the book what it was.
No, not a live one.
She let me have it. She said you can have a feel if you want. I went, all right.
But I was really ready for it, so I went and got myself fit and all the rest of it, because I knew about the BMI. My friend had to wait a year before she got her BMI down, and the blah blah blah.
Well, you knew far more than me. I blindly went into it.
But yeah,
That's the gung-ho approach that is Janet going for.
I just thought, oh, it'll be all right. Well, no, I was very nervous, but when I'd seen this woman, I thought, 10-hour operation, what could it be?
When I said to the nurse, "Will I have a flat tummy?" She says, "Oh no, it won't be fat." But that was all I went on about in a quiet session. How flies my stomach? I'm showing everybody.
No, everybody that came to visit me.
From then,
Everybody that came to visit me, I was going, look at my breast.
I know,
yeah.
empowering. I've still got a flat tummy now.
Anybody that just happened to wander past.
Well, I haven't. I've put some weight on, really.
Yeah, well, Dr. Barlow was that impressed with me. I've actually been and had photos so people can actually look at what the tram flat looks like afterwards.
Really good.
Yes, and the uplift as well. I've had photos for that.
Yes, I had photos, but it reduced me to tears. I felt like...
No, I loved it. I thought this is the nearest to pastry. I know.
I was
quite
horrified.
proud by that too.
Oh, I was horrified.
And then it was a man. I thought, oh no, it's going to see my boobs. I thought, oh, forget it.
Yeah,
I'm disappointed that nobody's done that for me.
oh,
Leave out.
it's Mr. Barlow. He said to me, now,
There you go. Just turn around and ask. Yeah.
I don't know why I
You
didn't...
could have a T-shirt made, actually, couldn't you? You know, just ask. It says just on the front and then ask on the back. Mine, you might get some very funny questions.
Might be nicer. I don't know why I wasn't like that. I was totally depressed about it.
Because I was really depressed.
Everybody's different, you see.
Yeah.
Before I had it.
We're all
I
different.
decided I was going to have no more surgery and had enough of it. But for a year, I got through that.
Yeah.
But then my stepsister was getting married. And
Right.
It
You
made
had
me
to meet
cry
Serene
because
You
I
couldn't
couldn't
sort
wear
of...
V-necks, I couldn't wear the low altar, because I used to say if you got it, flaunt it.
Exactly.
And it just absolutely pulled me. I know at the wedding I was like this with the dress. I thought, this is it. I've had enough. So now it's the next day. Reconstruction is on the cards. Just let you know. And they were all right about that because it's the end of the journey. they
Stand
said.
back and watch this.
But it's not. It's
And
not.
it completely
No.
changed me completely. So
Oh, I was upset when I went to have those photographs. I wasn't very well, so I had to be wheeled up there. Derek wheeled me up, my husband. Got there, pokey little room, pokey little corridor, no receptionist. This
no,
bloke,
that's right. Yeah.
this bloke comes out with a camera around his neck. I thought, oh,
Not exactly David Davis.
I got in there, this darkened room, and I thought, oh, I feel awful. Tears were rolling down my face.
Oh,
don't
dear.
So,
Oh, it was awful. I felt vulnerable.
I did, but then I thought, think of all the women you're empowering. So I had to return my head.
Oh,
round.
well, I wish you'd been in the room with me. I just
Yeah,
felt like
that's
a
what I
piece
thought.
of me.
I
I thought,
You make clever
Everyone's
moves.
going to see my head. They don't know it's me.
I
and
thought
all
it
these
looks a
women.
mess. It's horrible. I hate it. It's
Oh, I loved mine.
oh, I don't. I think it's horrible.
Maybe that is.
Why?
If you're not
Because
happy,
it's
go
like a
back.
Why
well,
don't you
can't
like
face
it?
anymore because it's like a lump of lard. It's just a lump.
Have you had a full reconstruction of the breast?
No, I've had a tramp. Well, yes, they've
Yeah.
made what they think it. And when
It's
I,
all your tummy, isn't it?
it's my
like-
tummy. It's the tummy. It's
I've got implant.
It's your own flesh.
You don't with that. It's just your own flesh, but you have to feed all the nerves up, and it's about 6 to 8 hour operation.
yes, I have to be.
Clever
That's 10.
stuff.
Yeah, it's absolutely phenomenal.
Very,
I think
very
that's what was
clever.
mind-blowing about how intricate,
How clever it is.
was.
Yes, I mean that
All right,
aside,
I've got scars from
fantastic.
ear to ear, but
So have I. It's like a massive scar. But, I went back and he said, oh, it's a good job. I said, do you think so? He said, oh, yes. And at that time I was worrying about, I thought, well, you know, it ain't really. There's no nipple on it. It's just like a piece of
You
lump
can
of
have a
flesh.
nipple.
Yeah, more pain.
It's not. It is. Well, I've had nipple reconstruction.
You've had the
It
nipple one,
Is
haven't
it
you?
not?
I
It's not
not
painful.
to. I decided
How
it
does
wasn't
it? Can I
anything.
ask you something? Because not having gone through that process, how do they do that? Because I know you
Yeah,
have
tattooing.
narcopigmentation where it's tattooed on. Is that
Tattooed.
what
Or
you're
you
on
can
about?
have a false one as well.
Oh right.
Well, I have.
Yeah,
you
you
go
can.
along. It's local anaesthetic, so they're just like doing it whilst
Yeah.
you're awake. And they
Yeah.
cut across here, and then create a little sort of nipple shape. So they
Oh,
gather
right.
it together and stitch it. So you've got something that looks a bit like a nipple,
Yeah.
and then you have it tattooed over.
Okay.
But
Oh,
it's
wow,
not
that's so
painful.
clever.
It took less than an hour to do
Did
the
it really?
surgery.
Oh, well, I've said I might. Because I've just had this reduced.
I mean, they
Well,
flattened
7
out
weeks ago. Yeah.
a bit. I think they just did.
I mean,
when I
I'm
went
not-
back to
I'm
the
not
surgeon, he
bothered-
said,
I'm not bothered
"Oh,
about
they're
the
flattened."
No, I'm
like,
not either.
"Oh, that's very rude. I'm very fond of them,
At
actually."
the end of the day, when it's cold, it doesn't stick out. It doesn't protrude.
Oh, yeah. They said to me.
See, that's the positive thing you see. How
Yeah.
you go like this and get rid of it.
They said, you do
You can
realise
have a wet
it won't
t-shirt.
function. I said, what
Well,
do you
not
mean?
really. I've got one.
I said, what do you mean function? I said, I don't understand what you mean.
There's no sensation.
Well,
No,
no.
there is.
I said, well, that's no problem. There's never any sensation anyway.
Can I just say that you say that you think it looks like a lump of lard? That's
Yeah.
because it hasn't got a nipple on it.
No,
Because I got used to that without the nipple, but then when I had that done and the tattooing, it's like you
That
put
made it feel
features on
complete.
the
It's
face.
like a face with features. Yeah, I can
it's
see
all
that.
right. But then I've had the reduction on this side about 7 weeks ago, and it's not balanced properly. It's
And if
balanced.
you're not happy, you go back because they'll do it.
Yeah, but they
Your
can't.
confidence is
Yeah, but they
there.
can't put it back. I had huge breasts.
No,
It's put too much
It's like that
on.
when you were on about though. It's the
You need a different bra then.
No,
To balance you out.
No, I can't. They've took too much away.
Oh, okay.
Well, I think they have. He reckons they've got the volume. And I said, well, you know, to hell with the volume. Oh, and then I saw this registrar, stupid woman. She said, I'm sending you back. I'm going back on Monday. I'm sorry, it's a bit negative, but sending me back on Monday because there's I've got some fat necrosis in here. And she says, oh, this is a lump here. I said, it's fat necrosis, dear. I said, it's been there for months. I said, it used to be a huge wedge in here. I said, it's gone to a P. She said, well, she said, in view of your history, I think we'll send you back to the breast clinic. I said, whatever you like, yes. And I thought,
But that's knowing your own body more than the person
loony,
you're with.
it's not cancer. How can it be cancer, dear? It's,
It's a tummy.
I just thought, this girl needs more training. But, yeah,
She's probably erring on the side of caution.
yeah, well, I
because
hope she
was
is.
She's better.
in
I
training.
hope she is, because if this is cancerous now, you know, well, it can't be.
But I think you need to give yourself time a bit more as well, probably.
I think you're right.
Oh, look at
Julie.
me saying that
No,
because
I think you're right.
I applaud you,
long ago
ladies. I
was
almost
it
feel like a
yours?
coward with not
long
having
ago
had the
was it
full
you had your
Monty. You know what I mean? You've had
2 years.
a much more traumatic physical experience
But each
to yourself than I have.
experience to
Having
that
s-
person
but
is
having
adds
said
to
When did you
that,
have your
adds
tram?
emotional.
Yeah, I
I'm just trying to
appreciate
think.
that
I
we're
did
all
last
in
year.
that place. Or
See,
we've
I
been
have
in that
Mr. I mean,
place.
Mr. Valmer's a wonderful surgeon. I would agree. He's lovely. You do it 212, 211.
I think with the surgery, 'cause my surgery is nothing like yours, but I think it is giving yourself time to come to terms with
Yeah.
it.
Yes.
So I know my
Yes.
consultant,
Yeah.
when I had my checkup after he'd done the surgery, and he was like, oh, that is brilliant.
Exactly.
That
And
is
you
so
think,
fantastic.
my work is
And I
wonderful.
was-
And I thought, shut the dot dot.
I think it is. I think they should be rightly proud